What does this mean for our country's healthcare system and people's care? Joining us on the telephone is Republican Senator John Thune of South Dakota. He's a member of the Senate Finance Committee and chairman of the Senate Republican Conference. Senator, good morning. On one hand, the administration with Obamacare wants to insure people, but what are they doing? On the other hand, cutting benefits for people who already are insured?
Well, good morning, Eric. That's exactly right. And we are, unfortunately, Americans are being reminded on a daily basis of Obamacare's broken promises, and Friday, seniors became the latest victims because, as you mentioned, these cuts now to Medicare Advantage are going to hurt millions of seniors who rely on that very popular program for their health care needs. And many of them choose Medicare Advantage because it's a more comprehensive and cohesive way to get health care services. And what this does is essentially now uses the Medicare Advantage program as a ATM card to pay for Obamacare. And I think every member who voted for this train wreck is going to owe seniors in this country an explanation for these Medicare cuts, and seniors who are already seeing higher costs and reduced access to the doctors that they like the most.
Do you think this is what, like a switch and bait?
I really do. I mean, I think that, this was part of it. When we were voting on this 4 years ago, we talked about the Medicare cuts and what it was going to mean to seniors, and all these things are coming to fruition now. You're having the higher taxes that are hurting small businesses. You're having the canceled coverages and the higher premiums and higher deductibles that are hitting individuals and families across this country. And now you're having the cuts that are hitting our seniors who are beneficiaries of Medicare Advantage. So this is just this is kind of a slow motion train wreck that continues to hurt more and more Americans. And that's why so many of us believe that we ought to start over. We ought to get rid of this thing and go back to the drawing board and do something that makes sense in terms of really controlling costs and coming up with a health care system in this country that benefits the American people.
Now, if you have Medicaid Advantage now and you're facing possible cuts, I mean, the administration says this will save money. It'll lower costs. Do you buy that? And what do you say to people right now who are watching who rely on this?
Well, it can't. I mean, it's going to increase costs. There's no way around it. When you expand the coverage as Medicaid as much as they have and try and get more and more people in, it's predicated upon, obviously, all these taxes and cuts to Medicare to help pay for that expansion. It's going to mean higher costs for people all over the place. And this argument that somehow this is going to lower costs just isn't true. I mean, there was nothing in this program that really constrained utilization or put downward pressure on costs. The only thing that does that is competition and giving consumers more choice. And what this was a heavy-handed, big government solution where you literally have the federal government taking over political control of 1/6 of our economy. So in my view, it's been destined to fail. I think we're seeing the effects and the results of that now and the impacts. And this is just yet another one, the Medicare Advantage impacts that are going to hit seniors all across the country.
And meanwhile, we're coming up to that March 31st deadline where the CBO said that they need, 7 million or so enrollees in Obamacare. This past week, Vice President Joe Biden was caught on camera in a Minnesota coffee shop saying, hey, they may get 5 or 6 million. He called that a hell of a number, a hell of a good start. But it seems that they may already be lowballing the number of enrollees that they're going to get. Do you think that they will reach the numbers that they need? And almost more importantly, Senator, the types of people that they need, that enough young people, for example, will be enrolled in Obamacare?
Well, I don't think they're going to hit the number, Eric, and I especially don't think they're going to get the demographic that they want to try and make this thing work. And that's part of why I say this is built upon a faulty foundation. It always has been. And that's why you see, the Congressional Budget Office coming out a week ago with a report saying that this is going to reduce full-time jobs in this country by 2.5 million. And it's also going to reduce by 1% take-home pay. So you're going to see reduced wages, fewer jobs. Though that's the impact of this, the long-term impact of this. And the fact that they're not getting the sign-ups, I think, suggests the American people don't have a high level of confidence that this is going to work either. And I think that you're going to see more and more of these dislocations and distortions in the healthcare marketplace in the weeks and months ahead as they don't reach those numbers, and those who are in the exchanges, who are participating, providers and insurers, are going to have to raise their costs even more. I think you're going to see higher premiums, even higher premiums coming up in the months ahead.
And finally, Senator, quickly, supporters, of course, say that people who need insurance will now finally be covered, thankfully. But your prediction is that it could spell trouble.
Well, it could. And, the thing is, of the people that have signed up, enrolled in the exchanges, they say only about 10% of those are people who don't currently have coverage of some sort. Now, granted, because of the expansion of Medicaid, they're going to get more people enrolled in Medicaid, but there are going to be an awful lot of people in this country who get their health care through their employer or buy it in the individual marketplace. We're going to continue to see these escalating premiums, higher deductibles, higher out-of-pocket costs, canceled coverages, and less access to doctors, fewer hospitals that are going to be available there to serve them. I think those are the things that most people are going to see. Will they get some people covered under Medicaid? Yes. But in the long run, this is the wrong formula and a really bad prescription for health care in this country.
All right, Senator John Thune, we thank you for joining us on the telephone this morning from South Dakota, and of course 5 weeks to go before that March 31st deadline. Senator Thune, thank you. Jamie?